with the Pledge of Allegiance and then a moment of silence. If you'd stand, we can do the Pledge of Allegiance wherever you might be there. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Sure, you got cell phones already turned off. We don't need to worry about that, but just maybe think tonight as we work that we might be able to do what is best for those young people that we work and serve with. We might be able to keep them in school and help them in their education for the future. Dr. Freeman, I think you're the next one online, or do I need to open it up? We don't have a public meeting tonight, do we?
No, we're seeking direction from the board, not action or the adoption of anything necessarily new or different. So I think members are aware. I sent out an update via email yesterday summarizing the action of the court. And to quickly summarize, because it was a concern of the board about the board doing anything that was picking and choosing which laws we would follow or not follow. The judge ruled that essentially that all of the bills that were passed, the 4 bills that were passed at the end of the session as part of the BRB package, which is Budget Reconciliation Bill package, not only didn't pertain to the budget, but were titled in a way that didn't portray the contents of the bill, which she ruled was a violation of the Constitution. And I think most people, even those not attorneys, realized that was the case, and that they had been doing more and more of that lately, almost kind of daring somebody to take them to court, which they did, and we know the outcome. What I understand legally probably will happen is an appeal. Some politicians have already made statements to that effect. I did add a little bit on advice of counsel to my update, which is at this time the law is not in effect. The board does not have to do anything or change anything in order to continue making decisions about safe return to school and complying with those other federal requirements. And that probably what will happen is the attorneys appealing will probably try to skip over appellate court and go straight to the state Supreme Court. So that'll be the first thing you'll watch for to see if they accept that case. And then the second would be to have some kind of stay. But what the lawyers tell me is a stay essentially leaves things in place. So when the court ruled, there was not a mask prohibition in place. And to put a stay in place would have the same effect as there still would not be a mask prohibition until some other higher court said that those bills were constitutional and in effect. So essentially, even though there may be a continued legal wrangling, the current status of the law is that those 4 bills aren't going to be in effect. There were a number of things that even included first readings of policy in our last regular meeting that no longer are in effect. So those are going to be pulled from the October agenda for second reading. And that really addresses one of the main issues that was previously discussed by the board. Then the other is masking, testing, or vaccination, something that the board wants to address. And what they have historically done is talked about face coverings but not treaded into the territory of testing or vaccination. So we have not prepared any kind of discussion or proposal that has to do with vaccinations or testing. What we do want to discuss tonight and get advice from the board is on face coverings. The metrics that we have shared and that are part of the backup material tonight show that the Littleton district metrics are deviating in trend from the county. The county appears to be dropping, and our school district disaggregated data shows a sharp increase. We don't know if that will continue or not. If we were following the county trend, but at a district level, we'd feel pretty confident that it was declining. But because we moved in the opposite direction, we're not sure. Again, I would remind the board and the public that data is a couple weeks old. The declining trend data of the county is current. In other words, that slope where you see the county data moving down, the green lines, has continued to move down. Sometimes these blips we get, if you look at the left side of the graph where the data went up and down and up again in a pretty severe zigzag configuration, some of that sometimes is attributed to not a change in disease, but in issues that have to do with reporting illness. So in some cases, it's underreported and then it catches up, and then it's underreported and it catches up. And that's why sometimes I relay a trend line graph. If you look at those zigzags on the left side, you can kind of draw an average line through them and assume that what you may have seen was something in the mid-high 20s slowly rising, but the variation, the zigzag, is a reporting phenomenon, not necessarily an illness phenomenon. We don't know. They do go back and clean up that data sometimes. And I usually look back a report or two to see if those are changed and adjust our graphs. So we could be looking at a blip, which is a reporting blip, or we could be looking at a trend in our region and our neighborhood. One of the things that I report to the board in my weekly COVID update is the vaccination rate. And so the average for all people in the two zip codes, 85323 and 85353, is running about 48%. If you look only at eligible people, it estimates 62%. I'm not sure how solid that data is because we do see some discrepancies. Arizona is supposed to be running at 51% and the US at 56% of total people vaccinated. So that 44 falls in line a little more with the trend that we've been tracing. I think people have heard that there was a study done, an Arizona study done of masked and unmasked schools, that schools that are masking are 3.5 times less likely to go into outbreak status and to be able to remain in in-person status. And as you know, from our data on the number of cases and students quarantined since we started masking, our quarantine numbers and kids and exposure numbers at school have gone down quite a bit. The management team, as we discussed today, thinking about considerations for the board, really would like to keep our policy close to the recommendations of Maricopa County Department of Public Health. So the supervisors in the county are still, I don't think they use the word requiring or recommending or expecting masks. Their material all says masks should be worn indoors where you have a large number of people. And of course, you can't stay 6 feet apart. And our thinking really from looking at all the material on their website is unless our illness rates drop to 100 or below, and our positivity rates start to drop to 10 below. We really shouldn't relax that. Uh, that's that's kind of a management view in us keeping close to the county health department and not superimposing the superintendent's or the administrative team's judgment as being, more informed or superior to what the county health officials are saying. Of course, things are more complex than that when it comes to um, certainly the dynamics and the politics of the community and your constituents and things they may be saying to you. So we do want to get direction from the board about if we want to stay the course, deviate from that at all. We do have exceptions in place, of course, where there are special needs or medical needs. We also have an exemption in place, and you have to sign a waiver to go with that. That number, since we last met, has only gone up by 3 students. It still is only 8 families that are exercising that. It's not conditional. Some states are putting conditions on exemptions where you have to have documentation to go along with that. Littleton hasn't done that yet. Um, and we continue to allow the kids to, when they're outside playing, take off their masks. We think it may be possible to have other kind of outside activities where the threat of spread seems to be much lower. We continue to try to limit the cross exposure of groups at school as much as we can, but still be able to provide program supports. And of course, masking has helped us be able to do that, where we can look at just a 3-foot gap between the kids and do our close contact tracing estimates on the mask guidelines instead of the unmasked guidelines. I would say we're also hopeful. This is looking forward, not really uh, for guidance for us from tonight going forward, but to be aware that there are rumblings that the Pfizer vaccine may soon be approved for students. I think it's age 6 and up, 6 to 11, adding that group of school age kids, which would be significant. What we anticipate will happen is the adults who were either eager or willing to get vaccinated will also vaccinate their children. The people who are reluctant or resistant will be less likely to vaccinate their children, but it would increase the number of vaccinated people in the community if we got to that level. And that could be really helpful as far as mitigating the amount of illness and positivity in our 2 zip codes in our region and in our school district. So I think that's a hopeful sign that if some of those changes begin to happen, that we'll see some change in metrics and maybe some opportunity to lighten up our mitigation strategies a little bit. My personal feeling is I think we should exercise as light a hand as possible to still provide for the safety of staff and students. And so I think there is a little bit of judgment involved there. We are going to provide another vaccination clinic. That will come up again the Wednesday after the next regular meeting. That'll be October 13th. People can get first shots or second shots, flu shots, and booster shots. And the education community is part of that vulnerable group. So people in the community who are educators, but not necessarily educators in Littleton or 65 or older, will be able to come to that clinic for boosters, first and second vaccinations, as well as flu shots. And then we'll have one more in November. And we're really hoping to be able to help contribute to the community for flu vaccines as well, because that will become more and more of a concern as we shift from the fall into the winter months. I think that's most of everything I had by way of backup material and updates, Mr. President. So, I would ask you to facilitate a discussion of members to let us know if we want to stay the course, at least until the next meeting, which is 2 weeks away, or make some changes, how members are feeling, and if there's any consensus on the board. And we'll know if we need to communicate anything new to the community about what we're going to do as far as mitigating the spread of airborne virus. We are working on procurement for ionizing our air handling equipment, and that's in the works, but not ready to pull the trigger or do installation yet. But that work does continue too, to help improve the learning environment safety with mechanical life support systems. So a lot of things in process.
Thank you very much, Dr. Freeman. Appreciate the update and the insight. And any comments any of the members of the board would like to share at this particular time? I can't see your hand, so if you would just like to let me know.
Mr. Nilsson, this is Kathy. I just have a few comments if I can.
Please, Kathy, go ahead.
So, Dr. Freeman, I've listened, I've read, I've talked to some staff and the district office, and I think I kind of wrote my comments. I do agree with continuing the county health. It gives you that supports, and it's easy to support because that's the guideline. So I do agree with continuing with the county health. I think with the exemptions being low, and I've heard minimal concern, me personally, from community. And in talking to staff, they have indicated they're not hearing from parents or others that masks have been an issue. So I do like your comment, exercise light hand, but providing safety. And I mean, at the end of the day, that's really what this conversation is all about. So I think hearing everything, talking to some people, I'm okay with this course we're currently on, and this is kind of a moving target, and I'm okay staying where we're at and reevaluating it when that becomes appropriate.
Thank you,
That's
Kathy.
all.
Appreciate those comments. Amy, anything?
I agree. I think that we need currently to stay with where we're at. I also haven't heard very much from the community that they're upset about using masks or wearing masks. And I just think that we're keeping our kids in the class, which is ultimately the goal. And so until I can feel more confident that either the vaccination rates increasing or our metrics are going down, I agree with following the county guidelines.
Thank you, Amy. John?
Yeah, thank you, Mr. President. And I also agree with the two statements previously made by board members. The county, as well as the CDC, recommends face coverings for non-vaccinated populations. For the safety of our students and teachers, I think it's important that we maintain our current requirements. Not only is it recommended by the CDC and the county health department, I think we've seen within our own data that as soon as the mask requirements were in place, our transmissions and quarantines went down, and we were able to keep many more students, hundreds of more students in-person learning. And I think that is so important that we have as many students as possible in student or in-person learning, excuse me. So I am, again, as the other members said, in support of continuing our current course of action until the county data is at a place where we're at a moderate or low transmission rate, and or as Ms. Sochanek said, we have a really high vaccination rate. And I think those two things will really go hand in hand, frankly.
Thank you very much. Sarah?
I am going to agree with everybody, with the, the rest of the members. Our students are in school. That's reduced the number of students having to be quarantined. We're following the health department, the guidelines. I agree. I think we should stay, with the current, things in place and continue with how we're doing.
Thank you. I guess I agree with all of you. I just like to share a couple of things with you. Sometimes it gets personal. I know you were in a classrooms. I've got a granddaughter that's 12 that was tested for COVID back in January and tested positive. So in March or April, she got her vaccination and haven't been wearing masks, and evidently was out on Saturday with a bunch of kids, wherever they might be. I mean, we got school, but then we got weekends. And she came back home weekend and was feeling sick, achy, everything else. Took her in the doctor and she has COVID again. So she got it twice as well as the vaccination. I think, it behooves us, like we've already talked about, keep it in school. There's not a whole bunch we can do on the weekend, but during the school time, we need to do that. I think the other thing I thought interesting, last Wednesday morning, I had an opportunity to go up to City Hall with the Tolleson High School District Special Needs class. They had 25 kids in the City Hall, and the purpose was they'd been studying the Bill of Rights and just wanted to see how local government worked. Every one of those kids had their masks on, and they knew when it fell down that they need to put it back up and keep their face covered. So I think if special needs can do that, normal people can do the same thing.
Oh my.
But I'm in agreement. I think, Dr. Freeman, you've got some direction as to what you need to do. I think we need to keep the way keep the direction we're going. And as we said, I remember years and years ago when I was a Boy Scout, I had a scoutmaster who took me out there, and we were trailing him around and follow him around, and we followed him for hours and hours for hours. And in between, we saw him once in a while. When we all got together at the end of the day, he says, "Let me tell you something, Scout." He says, "You saw me, and you were there within about 5 or 10 minutes of where I was. You should have come to me rather than following the trails all the way around." And I guess I say that only because, yes, there are those who are doing studies and everything else, but we're on the ground right here. We can see what's going on, and we need to take care of our students, our staff, our teachers right here when we know what's going on. And if it means, keeping them on a little bit longer, let's do that. And Dr. Freeman and the staff can assess that and see what the numbers are as we've already talked and move forward. Thank you. I appreciate you listening.
All right, unless there's more comments, that was our only item. We wanted to, keep this a little closer instead of a 1 month interval on a 2 week interval right now, where I think people have a sense, as vaccinations go up, and I think there are some people who are taking the spread of the virus a little more seriously, and their impact on others a little more seriously. That if we keep moving in a positive direction, that sometime in the not too distant future, life is going to begin to feel a little more normal as far as that goes. I don't know anybody who likes wearing a mask, but I think a lot of us have grown accustomed to the importance of it, especially in mixed groups, especially indoors, and especially out of consideration for others, even if our own health is good. So Mr. President, we do have 2 meetings scheduled again in October. The second one is to review last year's governing board goals data, but we could revisit this at that session if we wanted, and that would keep us kind of on an every 2 week update, at least going into November up to Veterans Day. It'd be a little trickier to try to do that around the Thanksgiving holiday, but maybe by then, a trend will emerge and we'll know more. So staff certainly is flexible in preparing material and providing the background for discussion, and trying to work with all of you to keep current on what's happening, and whatever kind of potential enhancements or cautionary measures we can take. And we'll keep an eye on it, and of course keep reporting to you the data we have, so you have that for yourself and your constituents. But there's not anything else that we have for request of the board tonight. And, unless other members have final comments, we can move to the final item.
If none of you have any other comments, again, we thank you, Dr. Freeman, and the staff for putting that information together. If none of the rest of you have anything, can I have a motion to adjourn?
This is
This is
Kathy. I'll
Amy.
motion to adjourn.
Thank you, Kathy.
This is Amy and I'll second.
Thank you.
Mr. Nielsen,
Aye.
Mrs. Contreras,
Aye.
Mr. Raider,
Aye.
Mrs. Reyes,
Aye.
Mrs. Sushnik.
Aye.
Thank you, everybody.
Thank you all. Have a great rest of the week.